Oftentimes people are so overwhelmed and helpless by their medical condition, such that they are completely oblivious of the potential risk of certain procedures their healthcare providers are recommending to them. Have you been involved in a dire situation where you are the mercy of your doctor? While some of these invasive medical procedures can save lives, their potential risks cannot be wished away. Let's find out things you ought to know if you find yourself in these situations. Welcome to Ask AJC Health YouTube channel. On this channel we are 100% concerned about your overall good health, well-being and lifestyle. Feel free to visit our health and wellness blog and join our online community at Ask AJC Health website, www.askajchealth.com. And do not forget to like and subscribe to this YouTube channel. This will help with YouTube algorithms in showing you quality content such as this. Let's jump right in. Today we will be discussing 5 dangerous invasive medical procedures and surgeries that carry significant risks. While these procedures may be necessary in certain situations, it's important to understand the potential dangers involved. Let's dive in. Number 1. Cardiac catheterization. Cardiac catheterization is a procedure used to diagnose and treat heart conditions. It involves threading a thin tube, called a catheter, through blood vessels to reach the heart. While it can provide valuable information, complications such as bleeding, infection, and damage to blood vessels or the heart itself can occur. It's crucial to be aware of the signs of complications, such as excessive bleeding, chest pain, or signs of infection. Promptly reporting any concerns to your healthcare provider is vital. Number 2. Electroconvulsive therapy, also known as ECT. The procedure is used on patients with major depression or bipolar disorder that does not respond to traditional treatment. It involves placing electrodes on the forehead and passing electric currents into the brain. The electricity then causes a seizure which lasts 30 to 60 seconds on average. Although studies have shown ECT treatments to be highly effective in relieving depression and bipolar syndrome, the treatment has always been controversial for the possible damage it could cause to the brain. Some side effects of ECT include memory problems, learning difficulties, severe headaches, confusion, and fatigue. Number 3. Craniotomy. Craniotomy is a surgical procedure that involves opening the skull to gain access to the brain. It is performed by neurosurgeons and is used to treat a variety of conditions affecting the brain, such as tumors, blood clots, aneurysms, traumatic brain injuries, or epileptic seizures that cannot be controlled with medication. It's important to note that craniotomy is a complex surgical procedure and carries risks like any major surgery. Potential complications can include infection, bleeding, blood clots, neurological deficits, or reactions to anesthesia. However, advancements in surgical techniques, anesthesia, and postoperative care have significantly improved outcomes and reduced the risks associated with craniotomy. Number 4. Bariatric surgery. Bariatric surgery is used to aid weight loss in individuals with severe obesity. While it can have significant benefits, it's not without risks. Complications can include infection, blood clots, nutrient deficiencies, bowel obstructions, or even death in rare cases. Studies have shown that there are genuine risks of serious health complications. In a survey of 2,522 patients who had the surgery, 21.9% developed problems during the hospital stay, and 40% experienced issues within 6 months of the procedure. It's essential to have a thorough understanding of the procedure, realistic expectations, and a commitment to necessary lifestyle changes. Regular follow-ups and adherence to postoperative guidelines are vital for successful outcomes. Number 5. Tonsillectomy. Tonsillectomy is a surgical procedure that involves the removal of the tonsils. The tonsils are 2 small masses of tissue located at the back of the throat, one on each side. Tonsillectomy is primarily performed to treat recurrent or chronic tonsillitis, also known as inflammation of the tonsils, or to address other conditions such as sleep-disordered breathing or obstructive sleep apnea. Tonsillectomy is considered a safe and effective procedure, but like any surgery, it carries some risks and potential complications. These can include bleeding during or after surgery, infection, adverse reactions to anesthesia, or damage to surrounding structures. Critics of tonsillectomies claim that removing the tonsils does little to improve the symptoms in the long term, and causes unnecessary suffering. Besides the pain, a recent study linked tonsillectomies to dramatic weight gain in children. The procedure increases the chances of a child becoming overweight or obese by 61% in cases where the adenoids are left in. When the adenoids are removed along with the tonsils, the risk goes up by 136%. Remember, these procedures can be life-saving in certain situations, but it's important to be aware of their risks. Always consult with your healthcare provider, ask questions, and make informed decisions. Your health and well-being should be your top priority. Which of these medical procedures do you consider more dangerous? Which would you want to avoid at all costs? Please share your comments and feedback in the comments section below. Also follow the link in the video description for additional information and resources. Thank you for watching. If you found this video helpful, don't forget to like, share, and most importantly, please subscribe to our channel. That way we will continue to bring you great contents and more health tips. See you on the next video.